Hello, I'm Ohio Governor Mike DeWine. Welcome and thank you for joining us today for this important webinar. Ohio is on the road back. Thanks to vaccines and thanks to your efforts, we're getting back to the things we loved doing before the pandemic. Together from the very beginning, we have been committed and consistent about prioritizing older Ohioans in our fight against COVID-19. That has been apparent through your hard work in facilities and also throughout the state of Ohio. The vast COVID-19 testing program for long-term care facilities has helped us identify and prevent additional spread of the virus in our nursing homes. Ohio worked to get PPE to care facilities even when the nation faced great shortages. We also made nursing home and assisted living residents among the first in the state eligible for the vaccine. As vaccines became more widely available, we ensured that all older Ohioans had access in what we then called Phase 1B. Efforts continued through programs such as the senior housing vaccine clinics and homebound efforts. Ohio also moved quickly and was the first state in the country to put in place a vaccine maintenance program for our nursing homes and assisted living facilities to ensure that every single staff member and resident had an opportunity, a continuous opportunity, to get vaccinated. Throughout the last year, we have worked diligently to ensure health orders struck the important balance between protecting physical well-being and mental well-being. That balance has been center stage for many of the discussions and decisions made with medical experts. As the community spread finally started slowing down thanks to the wide availability of vaccines in Ohio, we updated those orders once again. Now is the time when we transition from orders to guidance. The orders outline what should be done, but now you know how to protect older Ohioans and how to incorporate those best practices into the daily operations of your facility. Ohio continues to make tremendous progress on our road back, but you must continue to be vigilant. Now, we are still seeing some outbreaks. They're certainly fewer than they were before, but they are occurring. And as our nursing homes, assisted living open up with increased interaction, and comes increased risk of additional infection. So please continue the safe and healthy protocols. Mask up in healthcare settings, mask up elsewhere. If you're unvaccinated, get vaccinated. Continue good cleaning practices and reduce the chances of illness by holding activities and visits outside whenever possible. We're trusting you to continue the important work of protecting those who have been most impacted by this virus. We're looking to you, the leaders of our nursing homes, our assisted living facilities, our adult care services, and senior centers, to help lead the way into the next phase of the pandemic. I know that the last 16 months has been very tough, and very tough for you. It's been a strain on resources and a strain on you emotionally. Thank you for your dedication. Thank you for your compassion. Thank you for making Ohio the best place to age in the nation. We are a better, stronger, healthier Ohio because of you.
Thank you, Governor DeWine, and thank you all for joining us today. My name is Ursel McElroy, and I am the Director of the Ohio Department of Aging. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. And throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. And while we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. During this hour, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. Ohio is on average at less than 50 cases per 100,000 people. And effective June 2nd, Governor DeWine lifted the vast majority of public health orders. The governor rescinded the Adult Day and Senior Center orders. And the state of emergency was also lifted on June 18th. We understand that senior centers provide important services for community members, but some senior center characteristics, such as frequent social activities, group dining, communal spaces, and shared transportation, may increase the risk of COVID-19 spread, especially for unvaccinated participants. Administrators and staff can help protect themselves and program participants from COVID-19 by promoting and engaging in preventative behaviors that reduce spread and maintain healthy operations and environments at centers. The Ohio Department of Aging's Ashley Davis, Chief of the Elder Connections Division, joins us now to cover some resources to empower centers to make the best decisions as they increase capacity and resume full services.
Thank you, Director. As we know, the situation is evolving, and we need to be proactive in our response efforts. To stay informed, ODA has developed a webpage to address where we currently are in the pandemic and provide specific information for COVID-19 resources for congregate living, including nursing homes, assisted living, adult day services, and senior center settings. We encourage you to visit aging.ohio.gov/roadback, as it will be continuously updated with resources relative to different congregate settings. The Senior Center section includes information on vaccine support, testing information, frequently asked questions, poster and signage request, and we have a congregate toolkit coming soon to support enhanced opening. ODA has also developed the Staying Connected booklet. Your organizations are uniquely positioned to support the needs of older adults during the pandemic. Importantly, addressing and enhancing social inclusion and connections. And you have continued to support these needs over the past year plus. The Staying Connected booklet includes important information such as screening for isolation, strategies to combat isolation, and other resources. To request booklets to distribute to participants you serve, visit our webpage on the slide to request these resources. We also have developed a toolkit for senior centers as they increase capacity and resume full services. Check back soon, as this resource will be added to our website in the coming days. It includes great tip sheets on congregate meals and communal spaces. It also includes signage and posters that centers can utilize throughout their spaces. While we encourage you to visit our website, we also encourage you to visit CDC website frequently. As some senior centers begin to resume and increase their level of activities, CDC offers the community-based organization considerations for ways these organizations can help protect individuals and communities and slow the spread of COVID-19. We encourage you to frequently visit CDC's website, as CDC will continue to evaluate and update public health recommendations for vaccinated people as more information, including new variants, become available. Please note that this guidance may be used to support your operational decision making. You know this space. You know the space that you operate and the risk that the organizations may be bringing both vaccinated and unvaccinated individuals together. We expect organizations to stay aware and tuned into local vaccination rates, as they differ greatly across the state. We also know that vaccines are safe and effective and provide opportunities for expanding activities. The second resource listed on the slide includes specific information on activities relative to risk-based on vaccination status, as well as prevention, masking and distancing to take place based on activity. Fully vaccinated individuals can resume activities without wearing masks or physically distancing, refraining from testing following a known exposure if asymptomatic, refraining from quarantine, and refraining from routine testing if feasible. For now, fully vaccinated people should continue to get tested if they're experiencing symptoms and follow local health department and CDC travel recommendations. There continue to be important infection prevention and control recommendations to prevent and reduce the spread of COVID-19. And as gathering places become a place for unvaccinated and vaccinated individuals who may be present, we need to continue to take smart, common sense prevention and control measures. These are the same infection prevention and control recommendations that have proven to be successful in mitigating COVID-19. The first practice is around vaccination. Senior centers are uniquely positioned to support vaccination for staff, participants, and volunteers. Providing education and dissemination of credible information about COVID-19 vaccines can support safe services at your center. We also encourage you to promote local opportunities for vaccination clinics or look into hosting a vaccination clinic at your site. We also encourage you to stay home when appropriate. We ask that you educate staff and stakeholders about when they should stay home and when it's safe to gather in person with other people for group activities. Look at developing policies and encouraging sick employees to stay home. We look to actively encourage stakeholders who are sick to stay home. Staff and stakeholders should stay home if they've tested positive or are showing symptoms of COVID-19. CDC's criteria can help inform people when it's safe to gather with others. If they have been sick with COVID-19, tested positive but without symptoms, and if they've recently had a close contact with a person with COVID-19. On to masking. Unvaccinated staff and participants should wear a mask at all times when in the presence of others. Masks protect the wearer as well as those around them, and they should fit snugly, covering your nose and mouth, and have multiple layers. Hand washing. Require frequent staff hand washing with soap and water for at least 20 seconds and increase monitoring to ensure adherence. If soap and water are not regularly available, hand sanitizer that contains at least 60% alcohol can be used. Rub hands together until dry. Also encourage staff and participants to cover coughs and sneezes with a tissue. Encourage alternative forms of greeting besides handshakes, hugs. For example, introducing a practice of new way of waving. Encourage clients and others coming to your office or attending events to engage in these same practices. And ensure that you have accessible sinks and enough supplies available for staff, visitors, and attendees to clean their hands and cover their coughs and sneezes at all events. On to ventilation. Ensuring ventilation systems operate properly and increase circulation of outdoor air as much as possible, for example, by opening windows and doors. Do not open windows and doors if doing so poses a safety or health risk, such as triggering asthma symptoms. Reinforcing prevention strategies. So post signs in highly visible locations at building entrances, restrooms that promote everyday protective measures and describe how to stop the spread of germs by properly washing hands and properly wearing a mask. At events, broadcast regular announcements on reducing the spread of COVID-19 and include messages, for example, videos about behaviors that prevent spread of COVID-19 when communicating with staff, volunteers, and others who may be in your facility, attending your events, or receiving your services. Some additional recommendations. Consider participating with local authorities in broader COVID-19 response efforts. So, sitting on community response committees, collaborating with other community based organizations, and coordinating or limiting duplication of efforts wherever possible. Designate a staff person to be responsible for responding to COVID-19 concerns. All staff and stakeholders should know who this person is and how to contact them. Continue to have flexible and responsive operations and communications plans. Define roles, responsibilities, decision-making protocol so that the organization can adjust operations, services, and programming in response to changing community conditions. Continue to reconfigure office spaces, waiting rooms, meeting rooms, conference rooms, so that to ensure at least 6 feet is available for individuals. In situations where people can form lines, encourage people to continue to stay distanced by providing signs or visual cues such as tape or chalk marks. And continue to limit attendance at events to allow for social distancing and continue to host smaller events in larger rooms. Prioritize outdoor activities where attendees can remain at least 6 feet from others not living in their household. Stagger arrival times and locations for meetings and events, and continue to clean and disinfect regularly. Cleaning with a household cleaner that contains soap or detergent reduces the amount of germs on surfaces and decreases the risk of infection from surfaces. COVID-19 vaccines are effective at protecting you from getting sick. Based on what we know about COVID-19 vaccines, people who have been fully vaccinated can start to do things that they stopped doing because of the pandemic. As of June 16th, 80.3% of individuals over the age of 65 have received at least one dose of the vaccine, equating to over 1.6 million individuals. The Regional Rapid Response Assistance Program, or RAP, builds on previous support by committing teams of regional experts to help identify and diagnose issues with care delivery and provide support to resolve them. Assistance provided by the RAP teams include, but not limited to, vaccination, testing and cohorting, temporary support staff, and infection prevention and control consultation and education. If your center is in need of hosting a vaccination clinic at your at your senior center location for staff and community members, please reach out by June 30th, 2021. Center administrators should call 1-855-732-7632. ODA was able to provide 2 rounds of provider relief for senior centers and adult day providers. One was offered at the end of 2020 and the most recent this spring, 2021. The Office of Budget and Management, in partnership with the Ohio Department of Aging, released $4.95 million in additional funding to support adult day and senior centers who serve older Ohioans by offsetting some of the added costs of the pandemic. 39 adult day service providers and 65 senior centers received this funding across the state for the second opportunity. The funds are to support restarting and continuing services through this emergency. And this is in addition to the $4.8 million provided in December 2020 for pandemic cost and recovery and safe operational expenses. Next, we're going to go over a few common questions about resuming full service at senior centers. The first question is, we are preparing to reopen. Can we still receive state support for testing? Yes, at this time, if you choose to continue to test, state-supported testing is being offered at no cost to centers. If centers choose to coordinate their own testing, each center is responsible for all costs of testing. If participants and staff are fully vaccinated, is it okay to not wear a mask? Fully vaccinated people can resume activities without wearing masks or physically distancing, except as required by local rules, or regulations, including local businesses and workplace guidance. We know that it's been a year plus of wearing masks, and some individuals may be more comfortable wearing masks, have compromised immune systems, care for individuals at high risk, or are unvaccinated. We need to be kind as people continue to wear masks for their safety and the safety of others. The next question. Are centers legally permitted to require vaccination of proof of vaccination? Requiring vaccination is a local business decision. Centers should use their best judgment to keep staff and participants safe. Whether or not a private business is subject to laws or regulations affecting their ability to require proof of vaccination is a center-specific matter. Centers should work with independent legal counsel to develop and implement a center-specific plan for complying with all state and federal laws and regulations. We are committed to supporting safe operation for Ohio senior centers. We know that older adults are looking forward to safely returning to centers for services and activities that they enjoy. We are confident you can use these resources presented today to identify the best practices and safe operations for your center.
Thank you so much, Ashley. We understand that each center is unique and operations may differ from one center to the next. However, we encourage you to lean on these resources and feel empowered to make the best decisions for your staff, volunteers, and of course, your participants. Should you feel a need or desire assistance supporting your operation plan, please connect with the Regional Rapid Response Assistance Program team. So it's my pleasure to have with me today Dr. Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. Dr. Vanderhoff, you have been instrumental during this pandemic, coming aboard in the fall and serving as one of Governor DeWine's principal advisors on COVID-19. It has certainly been my pleasure to work alongside you, and I have simply been fascinated by your vast medical expertise and collaborative approach to getting things done. Now, when you arrived, we were bracing for an anticipated spike in COVID-19 cases. The vaccines were not yet available to us, and we entered December with the infections and deaths continuing to climb. Then, mid to late December, the vaccine arrived, and Governor DeWine made the critical decision to prioritize congregate settings, in particular, those settings that serve older Ohioans, such as our nursing homes, assisted living facilities, and soon after, Ohioans aged 65 and older. Most of us understood that if we were to have a chance to reduce the infection rates and deaths, we would have to work tirelessly to vaccinate residents of nursing homes, assisted living, participants of our adult day and senior centers, and older adults in affordable housing communities and other independent residential clusters. Our cases began to plummet, and the desire to relax visitation restrictions mounted. For some, nearly a year had passed without regular personal contact with loved ones. Recognizing the benefits, measures were put in place to balance the two safely: physical health and emotional well being. Now, while we appreciate that with every visitor and every worker, there is a risk of exposure, particularly from those who are unvaccinated. So, while cases and deaths have declined sharply this year, there is still a risk. So, please tell us, are we ready to take this risk?
Well, thank you so much, Director McElroy. There's no question that earlier this month, June of 2021, Ohio achieved a benchmark that we have been looking forward to for some months. We are now reporting fewer than 50 COVID cases per 100,000 residents, a place we haven't been since June of 2020. Reaching this benchmark really is a positive sign, a sign that Ohio continues to move forward into a new phase of the pandemic. We're seeing daily cases of COVID-19 fluctuate in the low hundreds, whereas we are seeing cases, nevertheless, that are reported in the thousands each day when we look back to the peak of the pandemic. So it's a big improvement. It's a really welcome improvement. And as you alluded, I think we can largely attribute these improved case rates to our vaccines. Quite simply, the COVID-19 vaccines are working, and they're working very well. And since vaccines became available for older Ohioans and are now widely available statewide, we are thankfully seeing fewer and fewer cases, fewer hospitalizations, fewer deaths, both in our nursing homes and in our other congregate living settings statewide. So one could really ask rightly, well, what about masks and other precautions? Can we be done with those? And my answer to that is that although the data really is promising, as I've described, everything's moving in the right direction. Nevertheless, older Ohioans, particularly those who are unvaccinated, remain very susceptible to severe complications if they become sick with COVID-19. And we know that people who are in congregate living settings, such as our nursing homes and assisted living facilities, and even uh, our older Ohioans who are coming for care during the day in our adult day settings, that's our most vulnerable population in the state. And when we look at the virus, we have to recognize that COVID-19 isn't sitting still. On the heels of the B117 variant that's now dominant in Ohio, we have another highly contagious variant, the so-called Delta variant, which is actually B1617.2, coming into the state. And reports from around the world suggest that this variant is making unvaccinated people sicker faster and is quickly replacing B117 wherever it arrives as the dominant strain. So continuing with COVID-19 precautions, especially in environments like nursing homes, assisted living, and adult day, will add another layer of protection to help keep more Ohioans, especially older Ohioans, healthy. Now, the case rate in the general population, as I've referenced, is decreasing, and we're very thankful that we have reached and have stayed below 50 cases per 100,000 residents. But progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, is why we're all feeling safer. It's why we are able to take some very welcome steps back towards the life we know, life without masks. However, we still need to take certain precautions in the settings that I've described. Our case rate in the general population has clearly decreased, and we're very thankful for that. It's decreased and it's staying below 50 cases per 100,000, but progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, that progress, that's what's allowing us to feel safer as we take important steps back toward the life that we have known, life without masks. But we still need to take certain precautions in the settings that I've referenced, in our nursing homes, in our assisted living, and our adult day settings. These are the settings where the population that is at greatest risk from COVID-19 when we look back at the data both in Ohio and across the state are being cared for. And masks have long been used with success now in not only these settings, but in healthcare settings. And during this pandemic, we have seen just how beneficial masks are in slowing the spread of the disease, particularly among the unvaccinated. Just look at flu and colds. How many people do you know who actually had a flu or a cold this past winter? Not only is it a good practice to wear a mask in a healthcare setting, it's also recommended by the CDC, and it's required by many hospitals and healthcare providers. Now, for those who are unvaccinated, I want to remind everyone that the threat of COVID-19 remains very, very real, especially now with the global rise of the so-called Delta variant. And so we really can't let our guard completely down. If you're not vaccinated against COVID-19, please continue to wear a mask in public. And Ohioans that are able to get vaccinated really should. The COVID-19 vaccines are safe and they are effective. They don't contain tracking chips. They don't change your DNA or impact your fertility or magnetize you. What they do is protect you and others from getting COVID-19. Now, staff and residents in our nursing homes, in our assisted living, in our adult day settings who haven't yet been vaccinated really should talk to their doctor to learn more about the COVID-19 vaccines. Congregate living environments are really special environments where we need to care for and do care for some of the people who are most vulnerable to COVID-19. So in these facilities, we need to be especially careful about creating a COVID safe environment. In addition to taking precautions like washing your hands and wearing a mask, you should take extra care to think about how you can help us limit the spread of COVID-19 in the care environment where you work. So, for example, should we be cohorting residents who are ill or test positive for COVID-19? Of course, we should. What else can we be doing in the environment where you work to keep the people you're caring for and working with safe from this virus? A virus which, as we look back over the pandemic, has taken a very severe toll, certainly on the population of Ohio as a whole, but especially on our older citizens. So remember the important role that all of us play in helping to decrease the risk of spread of this virus, a virus which we're beginning to win the battle against, but a virus which is certainly still with us and which we still need to think about as we get up each day to go into our workplaces and care for some of the most vulnerable Ohioans.
So, Dr. Vanderhoff, I do appreciate you walking us through that very important information. And I think what I find most fascinating is the importance of understanding the difference between some of the guidance that has come out for the general population and why we have to be especially vigilant within these congregate settings. Can you speak to that just again for a moment?
Absolutely. So when the CDC came out with its guidance regarding what we can do safely when we are vaccinated, it was really addressing how we live our lives in more public settings. And there's no question that when we are vaccinated, we are very safe in terms of our risk of getting COVID-19 and even of transmitting COVID-19 to other people generally. But we know from our experience throughout this pandemic that certain settings pose a much greater risk for the transmission of SARS-CoV-2, the virus that causes COVID-19, and for the population that either lives in that environment or is served in that environment. And of course, some of the environments where we have to be the most careful are those where we are caring for our older Ohioans or our older Ohioans are residing, our nursing homes, our assisted living environments, and our adult day settings. Those are settings where the guidance, along with the guidance for healthcare coming from the CDC, continues to point to the importance of COVID safety measures, including masking. The mask remains a very effective measure for us to help decrease the risk of the spread of this virus. So, thankfully, at this stage in the pandemic, we can feel really good about getting vaccinated and the safety that the vaccine provides us. But we have to remember that when we are in these environments where we are caring for vulnerable people, we have to take extra care and be extra careful. So one of the points I think it's important for us to remember is that the COVID-19 pandemic continues to evolve. It continues to change. And so, therefore, uh, the guidance, the healthcare guidance that we need to be mindful of will continue to evolve along with it. Our best guide for understanding what we need to do to keep each other safe is the CDC. And so I would encourage you, as this continues to move ahead, to look towards the guidance that the CDC provides regarding the environment in which you work, whether that's a nursing home, an assisted living facility, an adult day setting. The CDC will continue to be our best guide.
So, thank you for joining us today, Dr. Vanderhoff. We do appreciate your time and expertise.
Well, thank you very much, Director McElroy. I want to express my sincere appreciation and the Department of Health's appreciation for your leadership, as well as for all the wonderful work that so many Ohioans who are involved in every day in the care of older Ohioans have offered throughout this pandemic. Your hard work has really made a difference, and there's no question in my mind that the efforts of people in our nursing homes, our assisted living, and our adult day settings have made a difference in the health and the lives of Ohioans throughout this pandemic. So I'm very appreciative, as I know all the members of the Department of Health are, for the work of our Department of Aging and people in the elder sector.
Thank you. It's a privilege to address you, the staff who are committed to the seniors who depend on Ohio's senior centers. As a physician who's cared for patients just like those who have benefited from the services you provide, I cannot put into words the appreciation I have for what you do every day. This has been an extraordinary 15 months since the beginning of the COVID-19 pandemic. I have personally experienced the loss of patients I have cared for years. I've seen staff members who have become ill with COVID and reached out to me for advice and medication. I've had family members who have worried that I might bring the virus home to them. I've worn the masks and the face shields and gowns. I've used a ton of hand sanitizer. I've performed nasal swabs on other people and myself for over a year. We are now passing into the next phase of the pandemic, and I am so excited about the prospects of returning to a life that is similar to what I remember prior to March 10th, 2020. I understand that it can be similar and that it will be similar, but it won't be the same. Yesterday, I went to the store and I could have bought as much toilet paper as I would have wanted. I actually saw Clorox wipes and Purell on the shelves. I can now visit my 85-year-old in-laws. We're all vaccinated. I can go to church. I can go to a concert. I can go to a Cleveland Indians game. Over the past year, I've learned so much about appreciating the little things in life and the relationships that went away during the height of the pandemic. There are other things that I've learned this past year. I've learned that everybody deserves grace, understanding, and patience. And make no mistake, the pandemic has affected all of us in ways that we may not realize. I have learned that over the course of the day, when I ask people how they're doing, and they look and pause and say, "Oh, I'm fine," that probably means feelings inside not expressed. We're now entering a new phase of the COVID-19 pandemic. In fact, I have heard some people say this past weekend that they thought the pandemic was over. And while there are very few statements that I can say with certainty as a physician, one of them is that the pandemic is not over. COVID is still in our communities and it is among us. And until the entire world can have the opportunity to be vaccinated, like we have here in Ohio, the pandemic will continue to be a threat. Over the next days and weeks, it will seem like that threat has passed. We are unwinding the requirements and policies that apply to senior centers that you have been living with over the past 12 plus months. We will eventually be told that this is no longer an emergency, but nonetheless, the same virus that has disproportionately taken a toll on you and your peers and the population we care for remains in our communities and among us. We now have at our disposal the abundance of safe and extremely effective vaccines that, if widely accepted globally, would end this pandemic. In the meantime, the virus continues to make millions and billions of little virus babies, and every once in a while, one of those babies is not quite the same as its parent. It's not quite so perfect, and in fact, it becomes a variant. Eventually, one of these variants will be just different enough that the vaccines will not be as effective, and we could slip back into outbreaks like we experienced last fall. We can prevent this from happening through vaccination and continuing to practice all the tried and true methods of infection prevention, like hand washing and hygiene, wearing masks, especially around those vulnerable populations, especially the unvaccinated, and cleaning up after ourselves by sanitizing hard surfaces. Each of you will need to decide to continue these practices through the remainder of the pandemic, even if the Ohio Department of Health and Governor DeWine or the Ohio legislature rescinds the mandate to do so. Testing and infection prevention and control needs to be a part of what we continue to do every day for the rest of the pandemic, even if we're not told that we have to. This now becomes our responsibility. It's kind of like the analogy of school. We have made it through the elementary school portion of this pandemic when everything has been laid out for us and all we have to do is follow the instructions and color inside the lines. We're now entering the college portion of the pandemic where we get to choose what classes we take and what path we follow. The Regional Rapid Response Assistance Program, or RAP program, for which I serve as the Chief Medical Officer, stands ready to support you and your organization over these next important months. The state of Ohio will continue to provide testing supplies like rapid antigen tests and the ability to do PCR testing and to have vaccinations against COVID-19. If you go back to that metaphor that we're entering the college phase of the pandemic, think of the RAP program as that guidance counselor who's always there to help you get through your schooling. The program is supported through the Department of Aging with money allocated to fight the pandemic. We have 8 regional medical directors, some of whom will be answering your questions in just a few minutes. These medical directors want to help you and your team when questions arise about testing or the management of COVID. We have contracted with an organization of content experts in infection prevention who is available to you and your organization for COVID prevention and control, and also testing strategies, and to provide another voice that can educate about the value and importance of the vaccination acceptance. In medicine, we call this a curbside consult or a second opinion, and this is available to your organization at no cost to you. RAP has a call center that is available Monday through Friday from 7 a.m. until 7 p.m. Please reach out to the RAP for assistance if you have questions or a need. The most important aspect of the RAP program is that it is at no cost to you and it can save you time. Let you continue to concentrate on the services that you most want to provide, and very likely the RAP program could decrease illness and the loss of life in the coming months. Thank you.
Enhance cognitive skills. We provide recreational activities. So you can go to your senior center for scrapbooking, exercise, Tai Chi, technology enhancement. And during COVID, a lot of those things were transferred virtually for a lot of our seniors. We provide transportation, congregate meals, and home delivered meals during this time, which will also provide social connectedness. So when I think of senior centers, and I'm very passionate about the valuable services senior centers provide, not only because my mother's in that age group 82 and misses going to the senior centers, I feel we can assist by having webinars like this today because it clarifies the changes. We've been overwhelmed with several orders as things change and things open up. Also, I like the fact to reemphasize following the CDC guidelines, continuing the hand washing, social distancing as necessary, and providing vaccination education and opportunities. There's still opportunities to get vaccinations, if not from your local healthcare provider, from your federally qualified health center. There's still those opportunities. And we're also encouraging as much as possible outdoor activities to the degree possible. We have grab and go lunches. We have concerts in the parking lot. And we're also directing senior centers for guidance, as you're the guidance counselor, to contact the RAP program to provide testing. So that would be some ways that I think would help us get back on that road.
Thank you. Duana, Patton, I'm sitting here. This is the first time I've actually seen you, Duana, and I see the thing behind you that says "Gather Together," which is so apropos for senior centers. That's awesome.
Yes, thank you. I think it is, and thank you for allowing me the opportunity to be here and talk with senior centers and be part of this panel. I am the CEO of the Area Agency on Aging in Mansfield, Ohio. We serve 9 very rural areas, and we have many senior centers in our region who we are grateful to have the opportunity to work with and to partner with. I think, my biggest thing right now, when I think about senior centers and the advice that I might give them, and the way that I think about this, because I too have parents who are, participants at senior centers. And I'll be honest, if you talk to the seniors, they cannot wait to get back to the senior centers and see their friends and participate in all the congregate activities. But when I think about the role of the senior centers and the leadership and the decision makers at those senior centers, the participants are going to count on them. They are reliable sources. And so I think the senior centers, now that we will, begin to see more seniors back in those facilities, can play a very critical role in educating seniors about the vaccine, telling them about the benefits of it, and even helping them find local places where they can get the vaccine, or as Ashley had mentioned in her presentation, maybe even consider being a vaccine site and reaching out and finding those opportunities. But I feel like senior centers are the trusted partners for families and for seniors. And I look forward to the opportunity to watching them reopen in a very safe manner, and to see them be able to help us reach seniors that maybe we haven't in the past.
Great. Thanks so much for being with us. Sally, appreciate you being with us today. Can you introduce yourself, and I guess what role can you expand kind of on what was just said about senior centers playing a role in education to their participants as we kind of enter into the pandemic?
Absolutely. I'm happy to be here, and I'm glad to share some thoughts too. My name is Sally Bolin. I'm the executive director of a aging services provider in the Toledo, Ohio area called Memory Lane Care Services. We provide adult day services as well as many other types of supports and services to families who are caregiving. And certainly what I've found as a community-based aging services provider is senior centers play a critical role. Duana's right in regards to their leaders in the community, but as a provider, they're also a wonderful partner for us. You know, certainly during the pandemic, when adult day centers were closed and families were often remaining at home, you know, we worked closely with senior centers to link people to activities and home delivered meals and programs and such. And now that we're moving into a new phase of the pandemic, the senior centers will continue to play a critical role with the education they can provide to seniors about the pandemic, where it's what the current stages are in the community, vaccination, as well as looking to integrate the WRAP program into the work that we're doing, so we can continue to be not only a trusted partner for the seniors in the communities, but those aging service providers who also work very, very closely with senior centers to meet families' needs as individuals age. And oftentimes those individuals are caring for someone too, who often maybe come to our center. And I know several of our families, you know, they'll drop individuals off at our center prior to the pandemic and then go have lunch and play cards at the senior centers. And I know they're very much looking forward to that. So certainly as an aging service provider, we look forward to continuing to partner with you and appreciate all that you do in the community in regards to education and vaccination and testing. So thank you.
And finally, Dr. Lehner, I really appreciate you joining us today and lending your expertise to this morning's conversation. As you're aware, testing for COVID-19 in senior centers is not required. So can you help us understand why might senior centers consider implementing a testing program to help make employees and seniors more comfortable re-engaging with their local senior center, especially if we happen to see an increase in outbreaks later this summer or even into the fall?
Sure, and thank you, Dr. Wiegand. Before we go into that discussion, would you like to note the differences between the
Yeah, so what Dr. Lehner is talking about is that there really are two main tests that we can do. There is a PCR test, which is the most sensitive and specific test, the one that's most accurate. And it tends to remain positive for a period of time. So it's really useful to determine if somebody has been exposed to COVID. The issue is that is a test that is done and has to be sent out to a lab. And generally it takes 1 or 2 or 3 days to get that result. Well, that doesn't really help you on the day that you're doing the test. You know, what do you do? And so we now have these rapid antigen tests, which are available to senior centers that, you know, can be used in the center for employees or for, you know, participants as they come in. They take about 15 minutes to do. Basically, you can do them yourself. You need to be monitored while you're doing it, but it's very simple. It's just right in the lower part of the nose, and generally within 15 minutes we can get the result as whether or not it's positive or negative. Now, if somebody's asymptomatic and it comes back positive, we would not want them to come in on that day, because the concern is that they may actually have an active infection. It may be, though, that they don't, and the recommendation would be that they would go home and contact their primary care provider or go to an urgent care to have a test, a PCR test, which, as I mentioned, is a little bit more reliable. But it is really something that we have become more comfortable with, not necessarily in the senior center setting, but certainly we've done that in nursing homes and even assisted living facilities. So that's those are the two differences. The difference of a rapid antigen test is it does give you an idea if there's an infection going on right now. It's also a very narrow window. So there's only about 7 days from the exposure to where it's going to be positive and then negative. So it is very useful from that standpoint.
So yeah, thank you for that discussion. So why is it important to consider testing in the adult daycare and senior center settings? It's important because what we've learned, and we're in the college portion, using Dr. Wiegand's analogy, we're in the college portion of the pandemic, and we know a lot more about this virus than we did even 6 months ago. And so we know that a lot of our patients that are positive or have the virus may be asymptomatic, meaning they don't have symptoms. They're minimally sick, not sick at all. And yet, when we test them, they may show up positive. So it allows us to identify those residents, families, family members, patients, what have you, may be potentially infected with the virus. And if they're infected with the virus, they're potentially going to be able to shed and spread that virus in the facility. So it's important to identify those people and ask them to go home and have some further testing to confirm that they're sick, or to be able to determine that this is a false positive. In those circumstances, we're protecting families, we're protecting the members that come and spend the day or part of the day at a day center from getting the virus if they're not vaccinated, and taking that virus home to their families when they return home. So it really is important to consider, even if you don't have to do it. Again, we're in the college portion of this, so a good decision would be to offer that testing to those families and members, as well as the patients that come to spend the day at your facilities. Also consider a vaccination clinic. The WRAP program, and I'm the medical director for Region 1. The WRAP program has been very good at sponsoring and arranging for vaccination clinics all across the state for the last several months. And certainly it's something that ought to be considered as well.
Great, thank you, Dr. Lehner. Director, do you want to go ahead and help lead some questions from the audience?
Absolutely. So my hope is that with the balance of our time, that if you have questions specific to testing, vaccinating individuals, anything around infection prevention and control, this is the time to ask. You have a really great panel here. We want to give you the opportunity to have those questions answered. So as they come in, I will certainly share them with the panel. But again, I would encourage you, if you have any questions, please feel free to ask the questions now. So I do see one coming in, and the question is, how does the senior center get a supply of the rapid antigen test? Dr. Wiegand, you want to talk about that as it relates to WRAP?
Sure, and certainly, Dr. Lehner, you can chime in any opinion that you have. So the rapid antigen test is unique because you need to have what's called a CLIA certificate, a CLIA waived certificate, and that's not something that senior centers generally have. And so one of the things that we've done with the WRAP program is we went ahead and got our own CLIA waived certification. And so we took that off of your plate to be able to do that. So that allows you to participate in doing the testing. We ask you that you do the submission of the information when you do the testing, because the state of Ohio wants to make sure that if you're doing the testing, if it's positive or negative. So that's part of the, I guess, agreement that you would have. But the WRAP program can help support that, connect you. And I know Marlene, and up in the Cleveland area, there have been a couple senior centers and adult day services that have utilized that service. And so either Marlene or actually any of the panelists, if you have experience or thoughts about it, that'd be a great time to help further the conversation.
Absolutely. So here in Cleveland, we've had some of the senior centers that expressed interest in saying, I have my employees who are vaccinated, but maybe a participant's coming in and I don't necessarily have to do the testing, but I want to have some on hand for me just in case, as Dr. Lerner mentioned, someone has expressing symptoms or I have a question. So what we did was we connected them with the WRAP program. And it's very seamless for senior centers to receive the information. They make contact with Dr. Wigan, Dr. Coleman, receive their testing supplies and instructions because we want to guide them. Dr. Wigan and Dr. Coleman have availed themselves so much so that Dr. Coleman even provided an on-the-spot example of giving herself one of the tests to the nasal swabs. And so, we're able to bring comfort. I think someone mentioned earlier, it's bringing that comfort or that sense we're all here together and this is all new for all of us. So we're learning how to do this. And if you have questions, you have concerns, as we would say always, either to your children or loved ones, no question is a dumb question. Please ask, because maybe we didn't think of it and you can, but we're able to connect some of our senior centers who have the test on hand, may not use them every day, but who knows what might happen because we can't predict the future. I might need this next week. I may need it in July, but I do have them in hand. So they do have the testing supplies, especially since it's free of charge. And you're able to receive the supplies and the support from the WRAP program.
Yeah, the testing, in the beginning, we were doing the PCRs at first, and they sort of got a bad reputation because of the having to take a deep penetrating swab from the nose. The antigen testing that we're using now is so easy. It's the very tip of your nose with a Q-tip, and you have the results in 15 minutes. And that 15-minute wait is simply a cup of coffee and just sitting down and relaxing for a few minutes. The test results are available, and then you can go about your day. So the test is very easy, and the results are so quick, and it's so much worth getting that information and being able to relax and enjoy your day. So there's really no barriers to getting this test done at this point in time.
Okay, so I have a question that's come in. It says many seniors are anxious to return to senior centers to socialize and specifically to play cards. You've talked about keeping social distancing, but this doesn't seem possible for this activity. Please comment.
Yeah, so who would like to pose that one? I don't play cards, so
I'll take a stab at it. I think this goes back to senior centers, reintroducing at a very safe and intentional manner. And cards, when you think about cards, you're all touching them and you're handing them off. It might not be the best way to start to bring your seniors back. Other than, finding, other things that they can do where they're not touching. Maybe there's some other types of games or, I know some senior centers have, technology that they can use. And sometimes there's ways that individuals can engage in card games and the like on a computer or a laptop. But I definitely would encourage senior centers to try to think creative in bringing people back very slowly and engaging them in activities that, one, maybe outside activities, or two, ensure that they can keep that social distancing. I looked at the CDC guidelines and they have some really great, just nice checklists just things that you can test or question yourself. If we're going to implement, this activity, are we able to do these things to make sure that we keep the senior safe? I think at the end of the day, reopening is an exciting next step, but it has to be done in a very safe and efficient and intentional manner to make sure that safety is at the core of those decisions that you're making.
Dewana, you know what I would add? I think that is wonderful with the platform to start with. As you were saying, activities, I started to think that this is maybe the time when we have bingo, and we have even disposable bingo boards that are made of paper and things like that, some things that the senior centers have come up with, and doing creative things. So I agree with you, as everyone's touching things like when you go to the restaurants, the menus. We now have disposable menus, or the menus are on your phone where you have the information. So using the technology, I would agree with you absolutely to use that. Also, with the information that Ashley shared earlier, the CDC guidelines give you an idea of if you're vaccinated or if you're not vaccinated, activities that are more safe or least safe for you, and using some of that as a guidance. And I think as we become more comfortable, we encourage, as everyone has mentioned, education about the vaccination, encouraging more people to do this, then that is also our road to graduation from college and getting to the next step and being able to fully embrace and have our full activities back to where we were at one point in time. Thank you.
I agree. I think those are two really, what Dewana and Marlene said are really great points. And I'm so glad we're taking the opportunity today to talk about this and focus on this. I know as we reopened our adult day center, one of the things that we've learned a lot in the last 6 months that we've been open. And so starting small sometimes and practicing things and giving yourselves permission to change. And if something's not working, let's adapt and be flexible and try something else. Has been hugely helpful, because how we started when we first reopened and what we're doing today is very different, but still following guidelines that we need to follow. So
another comment that as we open up and bring, I was just going to say that maybe have some educational material available day centers so families can pick those things up, and about vaccination, about testing, so that they can take those things home and read them and become familiar and maybe more comfortable and consider getting vaccinated.
One other thing, if Director, real quick, that I'll add is one of the things that senior centers probably haven't worried or thought about is there's a service called an infection preventionist, which are very well known in nursing homes, and maybe less well known, but still, I think assisted livings are aware of them. But really, it's not a specialist that you all have really experienced. The RAP program has a consultant that we've engaged that are infection preventionists. They're nurses who really know probably more about COVID than I do. And, you can ask for a consult with them and say, you know what, we're interested in doing this activity or that activity, or what do you think about dining? Because, quite honestly, senior centers are so important for providing nutrition for the people that we serve, but we want to do it safely. Go ahead and call the RAP program, and we can get a consult and help you understand how you can do that safely. And if you do play cards, just use that. That was Purell, by the way. Okay, Director, you can go take it from there.
So the next question is, what is the status of any or all orders affecting senior centers and adult day service sites? So this question is illustrative of the point that Dr. Wigan raised early, and that is we are now transitioning from sort of the grade school level to college. And part of that means that it will be incumbent upon you to keep up with and be aware of and cognizant of the many moving parts of this pandemic. We will certainly post and keep information available on our website. But again, it will be your responsibility to check the website as well as the constant evolving CDC guidance. With respect to the orders, there were 2 orders that were rescinded that relate to senior centers and adult day services. The third amended director's order on the opening of senior centers that was signed on May 4th was rescinded, along with the third amended director's order on the opening of older adult day services centers, which was also signed on May 4th. These orders were rescinded effective June 2nd. And also, as earlier mentioned, we also had the state of emergency order as well lifted on Friday. So there are no orders specific to senior centers and adult day services. However, as earlier mentioned, we are now at the college level. So the responsibility, expectations that you will still put in place really good infection prevention and control methods, that you will still keep abreast of the current guidance on things such as masking and distancing, and also understanding and appreciating the vaccination coverage to the extent that you're able to know within your building, and in particular, what the positivity looks like within your community. So it is really important to have an awareness of these things and to have an appreciation for the resources that are available to you to help you during this time, and to certainly be accountable to yourself, to your staff, to your participants, and their families. And so I will move on to the next question.
Director, can I just make a quick comment about that? Because, you know, COVID has just changed the way that we think about infections. And obviously, this is the first time we've been in a pandemic in any of our lifetimes. But think back to, as operators of senior centers during the influenza season. This is basically just like an influenza season, but it's all the time. And so just you have to think about how what preventative things you put in place during November through March in Ohio in a bad flu season. And those are the things that really you need to put in place at this point. That was my only comment.
Okay, all right. So one of the questions is singing now allowed? And I guess if, I don't know, Dr. Wagon, Dr. Lehner, if you can talk about some of the concerns with singing, but how you could perhaps do it safely, and why early on that was something that we did stay away from.
Dr. Lehner, you want to take a swing at that one?
Sure. I've got a terrible voice, so I don't sing much, and I only sing quietly in church. But I think the idea is the social distancing. I think singing is fine, especially among vaccinated members. But I think the essence for the social distancing is most important. Keeping that distance so that as you sing, you're not anything that you might orally spread has a distance to go before it contacts the next person. But I think that might be an activity that you could consider limiting to vaccinated members as well.
Yeah, and I think what was brought out in the kind of introductory comments are, we know that vaccinated individuals, even if they become positive for COVID after being fully vaccinated, most likely do not shed significant amounts of virus. And so if they were unaware that they were positive, that really the risk is extremely small. And I think that's why the CDC has said, don't be concerned about mask wearing, and you can get together with friends. Outside's better. For the unvaccinated, the recommendation still is to wear masks. And so, singing with a mask on, it's not as ideal as belting out your favorite song without a mask. But that might be a good alternative. And perhaps doing singing outside would be a better solution as well. Besides, everyone in the neighborhood can appreciate how happy they are over at the senior center. So.
Okay. So there was a question about the cost of having an infection preventionist, and I'll just start and then I'll pass it on to you, because I think this is a good opportunity again for, I would think, for senior centers to take advantage of the RAP program and what the RAP program offers. Many of the infection preventionist roles within the facilities, and it can look different in a variety of spaces, but some of them already hold a position. So for example, in some facilities, it could be the director of nursing, and part of their duties are dedicated to serving in that infection preventionist role. Ideally, we would like to see someone full-time as an infection preventionist in certain spaces. While I know that it's not necessarily possible here, nor is it what I'm suggesting, I would offer to you that our RAP program can provide you with the benefit of having those same services, in the sense that they can provide a consultation on the layout of your physical plan. They can help you with information on how you perhaps would have to cohort or maybe even test, or just some of those really great practices. But Dr. Wagon, I'll pass it off to you so you can talk more specifically about RAP in this role.
Yeah, and we've utilized a consultant that was really engaged by, I believe it was the state of West Virginia, early in the pandemic. They were the go-to consultant for that, and certainly we've utilized them in the RAP program. And as I've mentioned, they're people who are nurses, who have gone through specialty training, who can look at whatever it is, whatever question that they have, that you have, and they can consider it. And I think one point that I think is important, and we've said this so many times that almost kind of has gotten old, but that we're in this together, and we have physicians that are committed to the RAP program, that even if the infection preventionists have a question, they can kick it up to Dr. Lehner or to one of the regional medical directors that are also at your disposal. And so, if they don't know the answer, just like I don't know the answer to every question, but I know where I can get the correct answer. And if we have to go to the Department of Health, we can go to the Department of Health, and we've done that. So, I think what I would say is that you all, I heard it, I think it was Director McElroy said this, that if you've seen one senior center, you've seen one senior center. You all are doing so many different activities that as you said, there's as many senior centers as there are Starbucks. And so for you to get a specific recommendation, one of the things that I think the RAP program can provide is pose that question based on where it is that you are functioning, what clientele you're working with, and what the limitations and opportunities are in your community, and help us to learn from your experiences. And I think that's the way that we can only become stronger as a program.
So Dr. Wagon, I'm going to give you two more questions here, and then if you have closing comments so that we can close timely. One is a burning question that's being asked, and the question is that of Dr. Amy Acton doll over Dr. Wagon's shoulder? People want to know what doll that is you have over your shoulder, Dr. Wagon. Can you tell everyone who you have over your shoulder?
Oh, it's my Fauci doll. Trust the science.
Thank you. Clarify that was Dr. Fauci over your shoulder. The question is around how do we contact the consultants that we've spoken of? And then I think that rolls right into the next one is if they could have the WRAP phone number again. They're really interested in moving forward, and they, I think, appreciate the benefits that you've laid out. And then following that, if there are any closing comments you have with your panel.
Yeah, so the WRAP hotline, which is open 7 to 7, Monday through Friday, 7 a.m. to 7 p.m. Don't call in the middle of the night. But it is 855-732-7632. And you know, I'll repeat that. It's 855-732-7632. And you know, I think we've said it. If you've missed the fact that it's just going through the basics of infection prevention, you know, recommending vaccination and masks. I know that that is hot button topic, will continue to be a hot button topic, but you know, it has made all the difference in what I've seen as a physician in really getting us to the place where we can start rolling back some of these policies and restrictions and those types of things. It is still among us. That's the other point. Just because an order goes away doesn't mean the virus has gone away. And so we just want to help in any way that we can, and look forward to the opportunity to do so.
Okay, I don't know if you have any final words. I do want to thank all of the panelists for joining us today. I also want to thank each and every one of you for participating. Again, I would encourage you to go to our website at aging.ohio.gov. There will be information on posters, signage, as well as if you have a need for PPE, we can certainly support you in that area as well. Testing, vaccines, and again, the consultation. We want to hear from you. We want to know that you're doing well, and we certainly want to be there to provide everything that you need so that we can continue to keep this really important sector of our aging network thriving. And with that, I want to thank you and wish you well as you begin to open these critical centers back up.